today's show, we're going to break down a new study finding for the first time that regular physical activity improves the effectiveness of COVID-19 vaccines and reduces the risk of hospitalization amongst vaccinated people compared to people who don't regularly exercise. This is a very important study for a lot of different reasons. Of course, we know that parks, gyms, and fitness centers were closed all throughout COVID, and unvaccinated people were prevented oftentimes from actually working out at those facilities, even though we now know that exercise is so important for both unvaccinated and vaccinated people with regards to how it improves immune competence. We're going to break down this study. We're also going to talk about an interesting ruling in the state of New York, where a judge found that it was arbitrary to fire city employees for their refusal to get vaccinated against COVID-19. And so a judge overrules the health commissioner and also the Mayor Adams, the ruling that suggested that effectuated policy that led to the firing of employees based upon their vaccination status. Now, it's been reported that these employees are going to have their jobs reinstated and also receive back pay for their wrongful termination. So we're going to talk about all this stuff. I think you're going to enjoy it. But first, let's dive into this new study talking all about exercise. The paper here is the association between regular physical activity and the protective effect of vaccination against SARS-CoV-2 in a South African case-controlled study. This study involved over 196,000 participants, and they were stratified into three different groups based upon their physical activity levels: low, moderate, and high. And the study was designed to test the hypothesis that physical activity is an effect modifier on the relationship between vaccination status and risk for hospitalization. What they actually found is regular physical activity had a protective effect against severe COVID-19 outcomes. Okay, we've known this for a long period of time. We've covered all of these different studies over the past several years on this podcast and channel. And so various previous studies have shown this association between exercise levels and also antibody levels with regards to COVID-19 infection. But this was one of the first studies with regards specifically around COVID to show that regular physical activity is a modifier with regards to vaccine efficacy. Okay, I want to share with you these numbers because these numbers actually are quite telling. The scientists say that vaccine effectiveness against COVID-19 related admissions to the hospital among vaccinated individuals with low physical activity group was just 60%. But 72% for the moderate activity group and up to 85.8% for the high activity group. Okay. They go on to say, compared with individuals with low activity levels, vaccinated individuals with moderate and high activity levels had a 1.4 and 2.8 times lower risk of COVID-19 admission, respectively. So this is very important because many people wrongly believe that if they just go and get vaccinated and go and eat donuts, remember Dunkin' Donuts and all the donut shops were giving away basically free lifetime supply of donuts if you show proof of vaccination. Krispy Kreme's was another one. And that is the exact wrong thing to do, because when you're given a vaccination for any sort of virus or pathogen, it's the protectiveness of that vaccination only comes when your immune system makes an immunologic memory against that antigen. And if you're confusing your immune system with insults from highly processed junk food and sugar and compromising your body's ability to sense and recognize that pathogen and then to create antibodies that will remember that pathogen should you be re-exposed in the future, you're causing a misfire within the immune system. So the best thing that individuals could have been doing leading up to their immunization is getting healthier, eating real food, not having sugar, not having industrial seed oils and a bunch of corn, soy, and grains and all these things, and actually starting to exercise. But as I've said multiple times, show me one public health official or president outside of Nayib Bukele over in El Salvador that has been promoting exercise, nutrition, whole real food, stress management, and sleep. There's not a single one. We've heard so much about how you need to stay on top of your boosters and you need to do these things. You need to wash your hands. You need to have hand sanitizer embedded on your skin at all times. But no one has ever mentioned exercise. Now, my friends, we have a study involving 196,000 individuals finding with a high degree of statistical significance that exercise, physical activity is an effect modifier of the immunizations that are supposed to be protective against COVID-19. You have again, comparing high versus low physical activity, a 2.8 times lower odds in the high activity group compared to the low activity group after vaccination if you exercise. This should be front page news. We can go on and on about all of the different diseases and ailments and metabolic health improvements that are linked with regular exercise and caused by exercise deficiency, but we can't get people to care, right? They have their vaccination status on their social media profile, on their dating profile, but none of them, I shouldn't say none, but virtually none of them have pictures of going to the gym, of gardening, of walking or hiking. We need to have the same level of exuberance, and that's why I keep promoting this message. Okay, the scientists say in the discussion, vaccine effectiveness as measured by avoidance of hospital admission was compared between vaccinated and unvaccinated individuals in each of the 3 physical activity level categories. In fully vaccinated individuals, we found vaccine effectiveness against COVID-19 hospitalization among those with high activity levels to be 86% and significantly higher than for individuals with low physical activity levels, which was just 60%. The results of all 3 of our sensitivity analysis confirm these findings. The findings suggest a positive dose response where high levels of physical activity were associated with higher vaccine effectiveness. Okay, this I think is important because this was the first thing that I questioned when we heard on the media 95% effective. I thought, well, for who? You're telling me you take a marathon runner or an Olympic athlete and you give them the vaccine and you give a morbidly obese smoker who eats at McDonald's, there's no way the effectiveness or the efficacy is going to be the same in those 2 people because there's immune incompetence, there's immune senescence in the overweight individual who smokes and eats McDonald's. And again, this is why they didn't know this. The programmers at Microsoft and Amazon and all these tech people who, really galvanized behind this whole movement, they didn't understand that immune systems have phenotypes. They're different based upon one's own metabolic health. Really important stuff. So they go on to talk about exercise prescription and how we should all be striving to be having at least 300 minutes per week of moderate to high intensity exercise. My friends, if you don't have a smartwatch, I have the Garmin. I love that because it tells you how many steps you get. It has a timer on it if you're doing a cold shower or a cold plunge or some breath work, and it tells you your moderate to vigorous minutes of activity, and that's an important thing to quantify. It also estimates your VO2 max, which I think is important. Okay, so definitely check out this study. Again, the reference is the association between regular physical activity and the protective effect of vaccination against SARS-CoV-2 in a South African case control study. Moving on here to Yahoo News. The title here is New York Supreme Court orders New York City to rehire payback wages to unvaccinated city employees. Okay, so the short and sweet version of this here is a judge found that the termination of these employees was arbitrary, was not based on solid science. And the judge says the health commissioner cannot create new conditions of employment for city employees and cannot prohibit employees from reporting to work and cannot terminate employees. The mayor cannot exempt certain employees from these orders. And Porzio noted that the vaccination against COVID-19 does not prevent transmission of the disease, but noted that the decision is not a comment on the efficacy of the vaccination. Okay, well, many people are changing their tune, right? We've heard, all of 2021 and the basically in the first part of 2022, that this is a pandemic of the unvaccinated. That if you don't get vaccinated, you are responsible for the spread and propagation and continual hospital admission of the virus. But we now know that the vaccination is an individual health decision. If individuals are high risk and are at advanced age, then data shows that perhaps they might benefit from an immunization. But the college age kids, the people working at coffee shops and so forth that are 20 years old, 22, 23 years old, they are statistically not at high odds of getting severe disease, okay? And so we go down a slippery slope if we start to coerce people to make medical decisions based upon the greater good, because then we're going to have to start taxing people for being overweight. We're going to have to start taxing people for being at higher risk of landing in the ICU because they smoke cigarettes. or because they drink alcohol, or because they don't exercise. So it's a very slippery slope. And I don't think most people want to start being taxed for the foods that they eat or the underlying health conditions that they have. If you tell someone, oh, you have high blood pressure and type 2 diabetes and you have congestive heart failure and so forth, low ejection fraction, oh, you're going to have to pay more for healthcare insurance. Oh, and by the way, you're at higher odds of developing severe COVID-19 and therefore being a burden on the healthcare system. You're going to have to pay extra money. You're going to have to pay a tax for your diseases. Most people are not going to want to do that, right? And that would be considered not fair. So then why were we ever considering firing people for not getting immunized? Because there was never any data to show that these available immunizations are sterilizing, meaning that they completely prevent and block transmission. I know it's news for a lot of you, but there was never any research to support that. We couldn't talk about that on social media platforms because they would deplatform us, but this is purely based upon science, and it's widely recognized now that that is indeed the case. And this judge admits this here and talks about this and obviously had researchers and health experts help him with this particular conclusion. And this is why many unvaccinated employees are being rehired by their employers after they were wrongfully terminated during the events in 2021. So I think it's important to know this. And again, if we were so concerned as a society that there are still people dying from COVID-19, then why all over the place are city employees? This is actually happening in Seattle as well with the police and also the fire departments and so forth, rehiring people that were terminated or unvaccinated and terminated as a result of that. So it's important, my friends, that we are transparent with science and that we don't use wishful and hopeful thinking to make public health policy decisions. We need to stand rooted in evidence and use evidence to guide us. So I thought you might enjoy this short video. As always, my friends, thanks for hitting that like button. Thanks for sharing this podcast. If you want to spread healthy messages and improve the lives of Americans and make America healthy again, check out our sister company, myoscience.com. We have a lot of great t-shirts that can help inspire meaningful conversations when you're out in public. I've met so many great friends, actually, now friends at airports, at coffee shops, at grocery stores, wearing shirts like that. Eat like your life depends on it. Lift like your life depends on it. Make natural immunity count again, and much more on our website. So we'll catch you on a future episode down the road. Have a great rest of your day. Bye now.